There's so much confusing and conflicting information out there around pregnancy and birth, and none of it comes from the people that are actually in the room. We are Sarah and Catherine, two Canadian labor and delivery nurses with over 4,500 births under our belts.
What if the nurse holding your hand during labor could also answer every question you were too nervous to ask your doctor? Hello, everyone. Welcome back to 4,500 Births Later. Today we are here with a labor and delivery nurse with 35 years experience. Since retired?
Well, almost.
Almost retired?
Yeah, it's actually been about 41 years.
Oh my
That's
goodness.
an RN anyway.
And she looks like she's 30.
Yeah.
Oh my God.
She's also a prenatal yoga instructor, has her own business, and she is a lactation consultant. I'll hand it over to you if you can tell us a little bit more about yourself.
Thank you so much for having me. I'm actually thrilled to be here and talk about my favorite things, which is anything about pregnancy, birth, babies, and then yoga. So I'm thrilled to be here. My name is Irena. I'm originally from the Netherlands, so I grew up in the Netherlands as well as Belgium, and moved to Calgary right after high school. So I was not quite 18. My parents thought I was a little too young to stay behind because I really wanted to pursue my dream of becoming a midwife. So from a very early age on, probably around 10, I was fascinated with pregnancy and birth and babies. So I had my career path visioned from a very young age. So destined to go to midwifery school in the Netherlands. Unfortunately, my parents moved. I was only going to stay here for a few months till my 18th birthday and then go back. But my parents bought me a horse, and that was also really cool. So I stayed, and midwifery wasn't a thing in the late 70s. So I proceeded to go to nursing school. Then decided to do first went to university to pursue pre-med, and then ended up at Foothill School of Nursing. Did a diploma in nursing and eventually a degree, and then landed in labor and delivery. So really following my dream with a few little detours, but I started as an RN in 1985. And I am retired from my job as a labor and delivery nurse as of about 4 years ago. Along with that, for those years working, I also worked in public health in maternity, lactation clinics, with birth education. So anything related to pregnancy and birth is just fueling my passion. And that's where I'm at from a career perspective.
Amazing.
What do you wish more expectant parents know before they walk through the doors of labor and delivery?
Wow. I wish that they would recognize how much innate wisdom they already have within them. I would hope that if they have prepared for labor through classes and through reading, that knowledge will serve them well, and to really trust that, to trust their body, to trust the baby, to trust the medical system, and to trust that they have it in them to find beauty in how their unique birth story will unfold. There's probably a lot of other things that I wish they would know. I think at the top of the list would be to not come into the experience with fear. So if we gather knowledge ahead of time, that really reduces that fear aspect. And I think that's huge. Every birth story is unique. In all my years as a labor and delivery nurse, I couldn't start to count how many births I've witnessed or have had the privilege to be part of. It's in the thousands for sure. And one thing I do know that nobody ever said at the end of their delivery experience, wow, that went exactly like I hoped it would. So there's always maybe a few extra chapters in your delivery story. Maybe it's a condensed version. Maybe it's even a Coles Notes version for some. But we don't really, we can't really determine or decide for them if their birth story was a good story or not a good story. It is such a personal experience. So what I've learned over the years, that of course, our goal is a healthy mom, healthy baby. Of course, right? We wouldn't be practicing ethical medicine if it wasn't. But there's so much more to that. Like, what was the experience like for her? Did they feel safe? Did they feel informed? And did they feel supported? And I think those are such important aspects of the birth experience. So I remember when I was pregnant with my first baby, which is now 41 years ago already. It's almost hard to imagine. And I was very pregnant. I must have been about 9 months pregnant, walking into a dry cleaning store to pick up some dry cleaning. And from the back up to the counter came this lady. And I remember thinking, wow, she seems too old to still be working. And not to be rude or anything, but she was definitely well past retirement age. And she saw that I was pregnant and she commented on that. And then she proceeded to tell me her birth story. And it wasn't really about the things that happened. It was more about how she felt throughout. And I'll never forget that. And that really spoke to me. And it really, I think, influenced my practice as somebody who provides labor support, that it is less about what happens in anybody's birth experience, but how did they feel? Did they feel safe? Did they feel supported? And those are very important aspects of the birth.
That is huge. I was thinking as you said that of when I was in nursing school and you go through the different clinical areas and in geriatrics and working with people that had dementia and they're unaware of what day it is or what era they're living in. I found these ladies remembered their birth stories clear as a bell.
Oh, yes.
You know, they would think that a doll was a baby, but they would remember their own birth story.
Underneath all those layers of what has happened since.
It's such a huge life event, isn't it?
It's probably, I would say, for most, the most transformative event in anybody's life.
Yes.
And it has such an impact. And somebody's birth story is just so important. And that's why I feel strongly that, women need to share their story. And when they share their story, somebody else, it needs to be somebody who can really hold space, right? To not respond and start their sentences or responses with yes, but, or at least you have a healthy baby, or yes, but you did have an epidural, or well, your labor at least was much shorter than mine. Those are not helpful. We need to hold space, non-judgmental space for how she perceived the experience. What did she feel as she went through it? And that's what she carries with her. And that becomes the voice that carries her into her motherhood.
I had a kind of a similar experience to you. It was a patient who had a cord prolapse, which, if anyone doesn't know, is quite a obstetrical emergency that needs to be taken care of urgently. We take the patient to the OR, perform an emergency cesarean section. And in this particular case, the patient was exceptionally calm, palpable. Every person in the OR commented on it. The anesthetist, the surgeons, myself, the NICU team commented on the mother's energy in the OR. And so I had to ask her in the recovery room, what brought you to that state? You were so calm. And she said, I just told myself before I came into hospital that whatever happened, I would be okay with. And in her case, the worst thing happened and she handled it beautifully, and I'll never forget it. And there's no judgment to other women that don't handle it, but it's just a thing I think that Sarah and I are working on to prepare people with the knowledge. And this is why we have you here today, to work on those breathing exercises to get almost into a meditative state before getting into hospital. So that even if it is the worst case scenario, a cord prolapse, you're good. You're safe. All of it. So
yeah. And to remember, and that, we might touch on this later as well, is that the baby, it is their birth experience as well. And we just mentioned that giving birth is one of the most transformative events of someone's life. But I would, it's a big deal. But I would guess it's a bigger deal to be born. And I mean, we don't remember that. But when you really put yourself in your baby's shoes, well, they're not wearing any yet, but they're your shoes. Imagine you're in this warm, dark, safe place. You can feel your mother's heartbeat, the swishing of the blood coming through the placenta. You can hear her voice. It is safe. Then they must know at some instinctual level it's time to be born. They're coming into the unknown and having to eventually, as a very helpless little mammal, mammal is maybe the wrong word for it, but yeah, they're now needing to keep themselves warm. They need to, they're going to have to work to find their nutrition or to stay nourished. They're exposed to the light, to the cold. That in itself must be a big deal. And then the event of being born itself, it's not like they can just drop out. And the mother and the baby work as a team. So the baby needs to use their innate wisdom to make all the right twists and turns and rotations to fit through the pelvis, to work with the contractions, to work with the space that is available to be born in the most efficient and safe way. So that is a really big deal. So when you're speaking to this woman who stayed so calm during those, that emergency situation, I mean, kudos to her, but also what an amazing gift for her baby, right? Mm. Mothers and babies are connected in every way. And, the stress that a mother feels, obviously the baby feels as well. And that's not that, you need to feel guilty about that if you feel stressed, but to have those nice deep breaths at times where things are really critical are like little notes of reassurance for your baby to say, you're safe, I'm safe, and we can do this together. And recognizing this is their birth story too.
Yes,
That's
absolutely.
beautiful.
Thank you.
On that note, I remember reading an article in, I think it was Psychology Today, a long time ago. So my youngest daughter is 19. And it mentioned that if you ask a child around the age of 3 if they remember being born, it's interesting what they say. So I remember walking down this trail next to a river, holding hands with Paige, and she was about 3. And I said, so Paige, do you remember when you were born? Yes, Mom. What was it like? Well, it was really dark and warm. And then it was really bright and cold and bloody and very scary. And then she just kept walking and picked up some rocks and continued on. And I was like, wow.
Wow.
Yeah.
Yeah. Wow. Yeah. My granddaughter, when her little brother was born, she was just over 3. And she was in that first week or so, I heard her say, she leaned over him and she says, hello, little brother. Was it scary being born? So she, just coming from a place where she remembered something and just kind of checking in with him how his experience was, which also, it's pretty powerful stuff, right? We store that somewhere. And I think when it comes to more and more, are we learning about, the trauma that women and families can carry and how that is significantly impacting their motherhood.
What are some things, like what are the 3 most important things you would say to an expectant mother that you want her to bring into the labor experience?
I love that question. So the 3 most important things would be to be as mobile as possible, to be as relaxed as possible, and like we already talked about here, to remember that the baby is going through the birth experience as well. So when it comes to mobility, the pelvis is a bony structure, but is obviously not set in space. It's in its space that it holds, as it's surrounded by muscles, ligaments, and tendons. So how the mother is positioned will change the shape of the pelvis in different areas. So, for example, if we externally rotate our feet and we come into a half squat or a full squat, we tend to open the top of the pelvis. any kind of asymmetrical movement, such as a lunge or walking up and down the stairs, can open the mid-pelvis. And then any kind of internal rotation where the knees are closer together than the feet will spread the sit bones apart slightly. So that opens the space at the very bottom of the pelvis. So we know that under the influence of the hormones, the pregnancy hormones, everything is just a bit more flexible and movable, and for good reason, to create space for baby. So we encourage every woman throughout her labor to change her position frequently. And that can be something as little as putting an extra pillow between her knees, or externally rotating versus internally rotating, to be sitting for a while, to be walking, to be standing, to be swaying. Whatever you can do will continuously offer the baby just different options in the pelvis as they are trying to navigate their way through. So it's not like we have to know exactly where does the baby need space, or where is the baby at, because is the baby still near the top of the pelvis or near the bottom. We just offer positions, and therefore offer the baby options, and then trust that the baby, using their innate wisdom, will navigate that space to their best abilities and most effectively.
If I can just make a comment there, a lot of patients love the idea of free movement throughout labor, and then they're told because of an induction that they have to start oxytocin, for example, or if they're a high-risk pregnancy, have to be put on continuous monitoring, so have the bands on their bellies. And a lot of people feel let down at that point and feel like they can't move around in the bed or in the room, but in fact they can. So I think that's a big point to stress, is a lot of hospitals have something that's called telemetry. And so we're still continuously monitoring your baby, but you're able to get up, move around, walk in the hallway, go in the shower. So I just want people to feel that it's still an option, even if you are told by the doctors that you do have to have continuous monitoring.
And the movements don't have to be anything too dramatic. Like, you don't be having to be doing lunges and squats but even something as changing the pillows, putting the pillows between your feet as opposed to between your knees, turning over from side to side, pulling one knee closer to your chest, getting on hands and knees. Those are all, incredibly powerful, to offer baby that opportunity to navigate that space in the best way possible. And, even on, outside of telemetry, that's even being, because telemetry is great in theory. We know as nurses, it doesn't always work that well, as far as us keeping close track of the baby's heartbeat. But being beside the bed with the monitors on, just plugged into the fetal monitor machine, you can still be on a birthing ball. You can still move around, just having one foot on a footstool and leaning into that back and forth. So there's, even on the monitor, there definitely position changes are just as important, and can be just as powerful,
Right,
for changing the space that the baby needs. So
thank you.
the second one would be to be as relaxed as possible.
Mm.
And that's not always easy, and it takes preparation. Just like the physical aspect of labor is very, you need strength and stamina and flexibility. So preparing for doing those position changes, for coming in and out of those positions, it's not something that you can just do if you've never practiced before. They're definitely going to be more effective when you practice. Same with creating that calm. So, ultimately, to come right to the punchline, the mind has to tell the body that it's an okay time and place for your baby to be born. So we are all instinctively wired to protect our newborn, and so are all animals, right? So, for example, when, let's say, a zebra is having contractions and she's in labor and the oxytocin is flowing freely, if she notices a tiger behind the bushes, her mind will tell her body, maybe just hold off a little bit, because this little zebra, baby zebra, not that I'm a zebra expert, I'm just taking an example, is far too vulnerable. If she would be born now, she would be. So the mind is an incredibly powerful tool to protect the newborn. So if we are perceiving stress, and our minds really, in our reactions to that, don't really differentiate between a tiger or somebody in the room perhaps that you're not comfortable with or feel safe around.
Which sometimes comes in the form of a mother or mother-in-law.
I was going to say that, but I was not going to pick on her this time. I have an amazing mother-in-law. But
it's a reality for a lot of people.
Reality, yes. So, not only would we release less oxytocin to make the uterine contractions either slow down, become further apart, or become less effective, because our body's going, whoa, we got to scope this out first to make sure it's safe in protection for our baby. But also, if we are stressed, we go into a fight or flight mode, which would increase cortisol and get the adrenaline going, because we are getting ready to run from danger. And again, maybe from our mother-in-law, maybe from a tiger. Well, not likely a tiger. You know what I mean? And that would tighten up the hip flexors and the muscles surrounding the hips. And that in itself would impede the space that the baby is needing. So it's like the mind just put everything on hold for a moment just to really scope it out. And I think as labor and delivery nurses, we've all seen that. Somebody comes to triage and they say, we've been contracting. We've been tracking our contractions. They're coming every 3 minutes steady. And we put them in a triage room and we put the monitor on, and the contractions are gone. Or they're now every 10 minutes. And they go, I don't understand. Well, we do understand, right? Because it is a new environment. She is perceiving a different level of, she's probably not relaxed as much as she was at home. So it takes time for the body to reaffirm that the situation and the timing is safe to be actively laboring to bring this baby into the world. Same as we see even right before delivery when we bring the NICU team in. Everybody's ready, but the vibe and the energy in the room has changed. So the body slows down the contractions temporarily. And
we've all seen that.
And it just makes so much sense. Our bodies are, it's, our body and mind work as one, and it's so wise, right? It's so wise. And we're wired to just, do the best thing for our babies.
Very interesting.
We're so, instinctively protective for our babies, and that starts before they're born, right? Mm-hmm. And this works up and below the level of knowing or consciousness, but I am pretty convinced that must be it, as animals do the same. Some animals need to, give birth in private, right? Because otherwise they just don't feel that it's as safe. I think I remember, I hope I remember the facts right. My brother went to vet school, and I think one of the assignments, this is, I have to dig deep into the past of quite a few years ago, was to observe horses give birth. And it was kind of like a trick assignment, because when horses are watched, they don't give birth. So the power of the mind is pretty incredible.
Mm-hmm. Very cool. And the last thing that you would bring into the labor room?
Yeah. The last thing would be and we've talked about that a little bit earlier, that it's the baby's birth experience as well. It's a really big deal to be born. And like you said, we may even restore that somewhere. So I find that as birth, to have an element to them where things don't go as we had hoped for or planned, to not dismiss your birth experience as any more or less valid. So what I've seen in my practice sometimes, and I understand it. I probably was the same way when I gave birth. Let's say somebody is laboring and has pulled out all the stops and has tried so hard and was so well prepared, and and then cesarean birth is necessary, to kind of tune out, to kind of say, well, that birth story didn't end the way I was hoping, and kind of detach from it a little bit. And I always remind them that, can you stay really connected? Can you stay connected to the experience, recognizing this is your your baby's birth story as well. So can we still honor his or her way to come into this world and not think of it as any less important or beautiful? Can you find the beautiful moments and in this birth story? Not how you thought it would be, but how it has evolved, not just for your sake, but for your baby's sake, and really, really honoring that.
Mm-hmm. I think that's so important, that it's not, when the cesarean section occurs, it's not the end
Right.
of the story.
Not the end of the story.
I had a husband in the recovery room the other day that said to his wife, well, all of those contractions were for nothing.
Oh,
Whoa.
So that, to me, made it seem that the entire story he just wiped out with one simple sentence.
Yeah, just brought on failure.
And so my response was, in fact, those contractions were so important, and this is how it was meant to be. I think that's a piece of it, is the letting go of what it was supposed to be and accepting it for what it is.
and that makes me think of, I don't know if we can talk a little bit about the language that we use.
Yes, I think this is a great segue for that.
I was thinking about that as you were mentioning that comment of the father. I think that we sometimes use language around birth as professionals that can be very disempowering. And not because we mean to, obviously, but I think sometimes I've always thought there could be more awareness around the language that we use just without even thinking about it, and remembering the impact that that can have on the mother and the energy that creates and how that will have an influence on her perspective of her birth experience. And it may be something as simple that we don't even know of, that people will be asked who are expecting, who is delivering your baby? And they say, well, doctor such and such, or my midwife, or this midwife. I would love for them to say, I'm delivering my baby, right? First of all, our babies really delivered. They're not pizzas or Amazon packages, right? Babies are born, and it's the mother who is birthing the baby. So I think when we give that power away right off the bat, it's sad. It's disempowering, right? This baby, you are birthing your baby, and this baby is born from you. The medical staff obviously is there to facilitate the process, to intervene when medically necessary, to make sure everything goes safely. But ultimately, the mother birthed the baby. When labor at times is stalling out, or the contractions are not happening as effectively, and I mean, I'm including myself in the having done this, that we say, oh, what a stubborn baby. Your baby is a troublemaker. Why do we say that? We are labeling this baby who is obviously trying very hard to be born. No baby knows how to be a troublemaker when they're trying to be born. So it just creates this negative connotation. We talk about, as medical terms, we talk about incompetent cervixes. Incompetent? Whoa. What about inadequate contractions? It just rolls off our tongue, and we don't mean anything by it. We don't mean to be that disempowering. But a woman who is giving birth and early motherhood is very open and vulnerable to impressions and energy around her. She absorbs it, and it's stored somewhere. We might say things like, oh, were you a section or a normal delivery last time? And maybe we take a history, implying that having had a cesarean birth, and now we're referring to that woman as the surgical procedure. And we're also implying that it wasn't normal, right?
Mm-hmm.
When babies are maybe they're learning to breastfeed and we say, oh, he's just a little bit lazy, or it's just not, your baby's just not trying very hard right now. And right into motherhood, when we equate a good baby with a baby who sleeps on their own, perhaps independently. Does your baby need to be held all the time, or is your baby a good baby? And it's not that we say that, but it's the grandma or the aunt that might equate a good baby with a baby who doesn't need his mom. So I think it's just prevalent, and it kind of starts in pregnancy and around birth. We use a lot of these terms that I think, with some awareness, we could rephrase them. One of the main ones that got me always so upset, and I really was in a mission, and even held like discussion evenings at my home for colleagues to see if we can create some awareness around this, which is a medical diagnosis for a cesarean section indication, a cesarean birth indication, which is failure to progress.
Yes. I knew you were going to say that.
I know. I was pretty outspoken about that one. It gives me a chill down my spine when I hear that. It is, the word failure, that might be all the mom is hearing. And when we do that timeout in the operating room just before surgery, when her awareness is so heightened and she hears that word, yeah, I wouldn't want her to carry that into her motherhood.
Mm-hmm. So I think we've done a good job of stepping away from that. Good. So thank you for paving the way. And with our new online system, I don't even think that's an option when you click off a reason. Like there's arrested first stage or arrested second stage. Absolutely. I don't see it on there.
Officially changed.
Yeah,
but
thank goodness.
Being used. Yeah. Well, I'm not saying I'm not going to take credit for it.
No.
But yeah, it's still used though, and not intentionally to do harm, but I'm glad that officially it's no longer on the list of indications for a cesarean birth. And if there is an incident where it's misspoken, I think with the awareness from the mother's part as well, it might just register a little bit differently. If she goes, oh, I'm sure they didn't mean it, but I heard that word, and she might be wrapping it around, kind of wrapping that up a little bit differently before it's stored away, just with the awareness that.
Sorry. The other thing, where I think we've progressed with the language when we're taking a history is the C-section or a vaginal delivery. So I think normal is being taken out of it with taking a history, which is encouraging.
Yeah, that's great. That's great. Because anything that happens, 1 out of 3 births is pretty normal.
Oh, yeah.
So to still think of a cesarean as something that is so out of the norm, it's not really a realistic way of looking at what is true.
Mm-hmm. And just again, Alex, who we had on the podcast earlier, said when she goes into the OR having her 4th baby, she had 3 babies vaginally with midwives, and her 4th baby, she had to have a cesarean section. She chose to have a cesarean section. And she said she's going to bring in the same energy that she did with all of the other births. She's going to meditate. She's going to be present. She's going to have the music going. So, to be aware that with the cesarean section, you can still have all of that energy in the
birth, and it's still your baby's birth, and completely as beautiful and significant. So to really, I love that you say that, to really stay attuned to all the little moments and to take those in. What are the sounds in the OR? What did the air feel like? What people are present? What energy can I pick up on? Can I give those nice deep breaths to my baby right now and say, hey, we're good. We're good. I'm about to meet you. I know you can do this. And to really notice the beauty in that birth story, and not dismissing it at anything less than that.
I have a confession to make.
Oh, gosh.
Around language. And I consider myself pretty considerate when it comes to language around birth. And it was the end of a shift and I was giving a report. and to the oncoming nurse, I was summarizing everything, and I used the term, we came over from triage. She was having a lot of contractions. She was begging for an epidural, so she got the epidural, and I continued on, and not even thinking that word begging of how it would have impacted her. And I left, I went home, I slept, I came back the next day. And the nurse that I gave report to, she said to me, that patient was really upset after you left the room. She said, I wasn't begging for it. I just wanted it. Oh. And I was like, thank you for telling me, because this is something that so many of us have said, and not thinking of the impact that would have on the woman. So I have removed that from my vocab.
Yeah. And we've all done it, and we have, meant it in innocence. And so it really is just about creating that awareness, which obviously you reflected on it, and it was like, yeah, that's so true. Yeah. Thank you for sharing that.
Nice job, Sarah. I'm sure I have lots of stories like that as well. I just can't think of a specific one, but it's definitely an important thing to remember every single day.
And it's humbling. Because you're thinking about so many other things too, right?
Clinically.
Yeah.
Yeah.
Baby's heartbeat. What's going on?
We're multitasking. For sure.
Okay. Our next question for you. How do you balance the clinical side of birth and the deeply emotional and spiritual experience it can have for families?
Wow. So you can't separate them, right? So everything is connected in the yoga world, right? Yoga means union of mind, body, and spirit. So the mind and the body work together in the way that we can create calm. That's one of those most important aspects of labor that we just mentioned earlier. Even think of when you're going to cut a lemon, and you go to the fridge and you're grabbing that lemon. Before you even cut the lemon, your salivary glands are already reacting to it. It's the mind telling the body what to do. So it's the same, actually that's never more true or evident than when we give birth, as we talked about a little bit earlier about the importance of being relaxed and the mind telling the body that it's a safe time and place to give birth. So to create that calm is such an important part, because we are kind of infusing or combining ease and intensity at the same time. So even though the body is working really hard, the muscles are working hard, that uterine muscle is working, there is intense sensations. Can we meet those sensations with space, with calm, so that the work that the work that the body is doing is the most effective? So we're leaning into it, to the sensation, as opposed to resisting it. I hope that makes sense.
Yes, it does. Yes.
So when we, if I could just kind of go back or talk a little bit about the yoga practice. So the essence of the yoga practice is the breath. It's the breath that is our tool to create or to help find mental calm, to help create some space between our thoughts, to help connect ourselves with who we truly are underneath all the layers of the shoulds and our identity and our ego and our fear and whatever is going on. When we connect deeper, when we really focus inwards, we connect with our inner wisdom. We can connect to our wisdom on what our body knows on how to birth a baby. And we connect to our intuition. And when we drown out the outside noise and really focus within, and in labor, we often talk about that, like going into the zone, we can really listen. We can hear that voice of wisdom, right? And we can notice if the body is asking to maybe move a certain way, or lay on a different side, or our intuition really is our superpower. And we come with so much wisdom built in already as to how to have a baby. It's sometimes in life in general, we just get into our heads and we kind of drown out that inner voice. So when we create the calm, so let's say we're on our yoga mat, we're really cultivating this ability to find this ease within the effort, to find ease within intensity. So as we're going through a yoga pose, maybe holding, a standing lunge, focusing on our breath, we work the body at the same time we calm the mind. And then we practice that so that we can take that ability onto our labor experience. So even though we're having strong contractions or strong sensations, we are able to soften into it. We are able to create the calm for the muscles to relax, for our hip flexors to relax, to create more space, and to not resist the sensations that are happening.
Very
It's beautifully said.
Yes,
Beautiful.
Oftentimes, I catch myself saying to patients or asking them, you must take yoga classes because of their breath work during labor. And oftentimes they'll say yes. So I feel like every single pregnant woman should take a yoga class because there is such a change between patients that do versus those that don't.
Well, I can't agree with you more there.
The breath.
The breath is
the
the
deepness of the breath.
It's the most powerful tool we have. And
Yeah.
the beauty of it is we can't forget it at home. It's always packed, ready to go, right?
Yeah.
And we all know, even without, preparing for birth or practicing yoga, when we need to calm down, we need to take a big breath. And it's especially the exhales, the nice deep inhales followed by a long exhale, that will trigger our nervous system just to come more into that parasympathetic state where we feel calm, our muscles relax, we get out of that fight or flight. So it's just the perfect setting for labor to progress, right? So we're leaning into it is kind of the best way I can think to describe it. Because quite often when we feel pain or a strong sensation, we resist it, right? We push against it. Can we breathe into it? Can we soften into it?
Right.
Along those lines, with people that have taken prenatal yoga or have previous yoga experience, it's not just the breath, but it's actually the postures and the opening that I've noticed a difference with how well that they labor.
Yeah.
So much so, years ago when I was working in Vancouver, I was inspired to do my prenatal yoga instructor training based on that. Like, it was just incredible
So
to
it's
see
kind
the
of a
difference.
twofold benefit. So for those three most important things in labor, to be as mobile as possible was the first one. So if we in labor want to change positions, we perhaps want to do, a half squat or a low lunge, to help open up the pelvis. If we've never done those poses before, if we don't have the strength, the flexibility, or the stamina, like labor is not like a picnic typically.
No.
It's hard work. So if we've never practiced that, then we're not going to be, it's not going to be as easy to find those poses, to go in and out of those poses that might be helpful to create space in the pelvis. So it's kind of a twofold benefit, right? Not only are we learning to create the calm and tap into the quiet and to tap into our inner knowing and intuition with practicing prenatal yoga. I'm not trying to sell prenatal yoga classes here at all, just because I teach them. But yeah, it makes perfect sense, right? Our bodies need to be strong. So, people would say, well, I think I'll just let things evolve naturally and I don't really need to prepare because giving birth is natural. And, I'll just do it at the time. And, if that's somebody's choice, obviously that's their journey. But, I would be challenging them a little bit and saying, running is natural too. But if I sign up for a marathon and I've never practiced or prepared myself physically and mentally to run that marathon, I'm likely going to struggle a whole lot more. And giving birth could be the same. If we are empowered with knowledge to decrease fear, if we prepare our bodies with being strong and flexible, and we prepare our minds with the ability to tap into our own inner calm, that's going to serve us really well in our birth experience, no matter how that birth story unfolds, even when this is cesarean birth. Right?
So true. So true. What would you say to a patient who has never experienced yoga, has never tried it before? They're not flexible. Is yoga for everyone?
Yeah. Because it really is your individual practice, right? That's the beauty about yoga. It's connecting with your body, connecting, I always say it's more about somebody once said it's like residing in the role of the observer versus the doer, right? So I know we're called human beings. We're not called human doings. So can we be in our body? Can we be with our breath and let the magic unfold? It sounds a little airy fairy, but I was brought to my first yoga practice just by chance. It was a really dreary time of the year. It was raining, and I found on Sundays it was especially a difficult day. I was going through some, more challenging times in my life, and I just needed to do something on Sunday to pass the day, right? So it was this yoga class held in a basement of some community center. I can't even remember exactly where it was in a small town. And I went, and I was very sore after. It was quite an intense practice. But I went back and I went back again. And then I just started noticing this shift, not just on my mat, but also off my mat. I just felt calmer, a little bit more grounded. And then as sort of an added benefit, because that's ultimately the main purpose or the main goal of your yoga practice is to create that inner calm, to connect with who you really are underneath all the layers of ego and job and past experiences. But the added benefit of yoga is the physical benefits of building strength and stamina and flexibility. So it just kept calling me back. Wasn't even initially quite sure. Why is it that I keep feeling like I need to come back to my mat? And the more you do it, the more it becomes quite clear to me, that it put me in a really good space. So that's what, digging back a little bit, but what's initiated my practice. It's been almost 45 years now, or not 45, 25 years now. I started quite late. But yeah, it's definitely going to be part of my life.
With prenatal yoga, what is the minimum amount of classes that you recommend for people to take before going into labor?
The earlier you start, the more benefits that you're going to get from it. And I get that question sometimes. People will call me and say, my doctor told me to do prenatal yoga. So do I just take one class? Do I take several classes? Yeah, ideally, any class is better than no class. But I have girls who come to my classes. They start at 6 weeks pregnant if they're feeling okay, and they come 2 or 3 times a week. One girl right now is 40 weeks and 6 days. She's still coming. So it just depends, right? Depends if you like it too. So maybe it's not for everybody, but I think as a benefit to prepare both the mind and the body for labor and birth, I think that a steady, consistent practice would be ideal.
Awesome. And then my second question was to do with breath work. So if someone hasn't taken a prenatal yoga class, or if you think back to the days when you were at the bedside, what kind of breath work would you introduce to your patients?
Yeah, and when I started in nursing in the 80s, Lamaze was like a really big thing. And they had a specific, as far as I remember, a specific way of breathing at different stages of labor. So at first it was like in through the nose and out through the mouth. And don't quote me exactly how they were teaching it, or maybe it's still being taught. Yeah, and then it was the he he. So I would find patients say, "I don't know how far I'm dilated. How am I supposed to breathe?" So definitely don't recommend that. It just gets way too complicated.
Yeah.
So can you breathe in the way that feels right for you? Can you not hold your breath, right? Because as we're holding our breath, then we're really resisting the sensations. We want to, once again, as I said earlier, kind of lean into them, kind of soften and invite ease to the intensity of the sensations. So maybe in through the nose, out through the mouth, really focusing on those exhales as well. And that might change, right, throughout your labor as you get closer to the second stage of labor, where the uterus is starting to push down and trying to push your baby into the birth canal. And you're feeling that strong urge to push. Sometimes, if it's not quite time to push, then you can do little breaths like. But generally don't give a lot of feedback on how to specifically breathe in labor as long as we keep the breath going. Can we keep tapping into those longer exhales? And with the exhales, can we soften our jaw? Can we soften our shoulders? Can we send those big breaths down to your baby? Because you're breathing for your baby as well, right? And think of every breath as a little message of reassurance to say, I acknowledge that you're on this journey with me, and we can do this as a team.
Mhm. And the power of words, like even just having you say there to breathe, to relax your jaw. Yes, what I was doing. You were becoming
Softening.
more relaxed in my seat.
Don't fall asleep.
I know, I know. So the magic of words, even just saying the word calm
Yeah.
or relax.
Yeah. And that's where the support person, their role is so important. I don't ever want them to underestimate their role in helping to provide that calm or help their birth partner to get to that calm state. You know, they notice when your shoulders are up by your ears. They notice when your jaw is tense, when you have that big frown between the forehead. And they can remind you, let's take a deep breath together and long exhale. Can you soften here? You're okay. We're okay. We're doing this, right?
And physical touch, a hand on the shoulder.
The powerful effect of words and touch and reassurance is just, yeah. So it's, and as labor partners, you know your partner best. So you can also do things like put on her favorite music, like create the external environment that invites the calm, that can then help her internalize that calm. It's pretty big. I heard a quote once, I think it was by Pam England. She's a British midwife from Birthing from Within. And it goes, a calm, loving, watchful presence protects the fragile harmony of birth, and frantic coaching was never part of nature's plan. And I love it because so often on TV, what we hear, what we even see in reality is this rah, rah, push, push, harder, harder. And there's all this commotion in the room, and there's lights and there's sound, and not exactly a calm environment. What does the mind tell the body? Whoa, wait a minute. Is this baby safe if the baby is born now into this environment, or do I want to hang on? And I know sometimes it's necessary. There are emergencies where we need to act quickly, and there's more people in the room, and there's a lot more commotion. And I'm not, saying that doesn't happen or needs to happen. But just generally speaking, can we create that calm environment not just for mom, and also, and knowing the partner has such a big role in that, like even just dimming the lights or a little bit of massage or some encouraging words. Good job, babe is great, but good job, babe for 12 hours straight with a longer labor gets old. Maybe he can say somewhere, the partner can, he or she can say something like, "Oh, I can't wait for us to be a family of 3," or "I am just so proud of you. Your strength amazes me." Those resonate differently.
Yeah.
And then when it comes, the other part of that is, when the baby is born, we're really inviting the most incredible, special guests we've ever welcomed into our world. So I think that should be taken into consideration as well. What kind of space and energy is the baby born into? Maybe we can turn up the heat a little bit. Maybe we can dim the lights. Maybe we can be a little bit more aware of the noise in the delivery room. Can we not clang those instruments on the delivery table? Can we be a bit more mindful about just being quieter? Can our voices maybe go down a little bit? Just really honoring and recognizing that the baby comes from this safe, warm, dark environment, and the transition physiologically is already huge as they come into the world and need to start using their lungs for oxygen and all the things that need to happen in their little bodies to cope with being on the outside. Can we at least make their environment welcoming and soft? You know, because I think if we have a very special dinner guest and we're entertaining that evening, what do we do to our space to welcome our friend or relative? We set the table, we create some mood lighting, we put some music on, we have it nice and cozy and warm with the fireplace going. That's what we do to welcome when we're hosting. So we are welcoming the most precious little guest to our world. So I think we need to have the same consideration for that as well.
I love that.
Yeah, it was beautiful. As you were saying that, I was thinking of how things have evolved over the years. And when I first started nursing in obstetrics, the C-section, baby comes out and it was cut the cord, almost hot potato, turn around. And then the baby's taken over to what we would call the first hour of life machine back then, but now it's the Panda. And now with the delayed cord clamping that happens for most babies, you have that first minute and how these OBs or their residents get to snuggle with the baby and wipe away the fluid stuff. Yeah.
And then a warm blanket. There's no reason why some of our sterile Huck towels can't be warm, right? So when baby comes out, that covers them, just to not lose that immediate heat and having that startled response to coming into the world. I love that. I love that.
Your story reminded me of something. I spoke to a patient a while back about her birth trauma with her first. And she said she felt like she was on an episode of Grey's Anatomy when she was pushing. She said there were 5 people around her and they were all yelling on top of one another. Nobody was present with her. Nobody had any type of connection with her. They were all trying to be louder than the other. So for this labor, we almost had it silent. It was actually in the OR. But we had a meeting. We did a briefing before we entered the OR with the obstetrician anesthesiologist, myself, and we all talked about keeping the level low.
I love that.
She had such a different experience, even though the other one was that natural vaginal delivery. She enjoyed her cesarean section more because of the energy in the room.
Yeah, I think those things that we can bring into the environment. And, if somebody loves music, like I love music, to me, music creates a feeling and emotion. It becomes part of my emotional landscape and really affects my perspective on the experience. So if you have your favorite music, then I would, I encourage all my clients in my classes to create a playlist, right? For you, your birth support partner, for baby, and just to help create that type of energy that you can really relax.
It's very individualized.
It certainly is. I remember suggesting to a couple, you can play music. And they said, what kind of music? And I said, anything you like. And I regretted that 12 hours later of listening to heavy metal, which is my least favorite of all times. But I kept saying, reminding myself, this is not about me. This is not about me.
That's funny. I remember the labor music that my husband at the time put together for my oldest daughter. It was really nice and chill. Be like a chill coffee house playlist on Spotify nowadays, but it became her calm down music. And so it went beyond the labor room. It was like this magical CD at the time that just made things chill for her.
Demonstration. Yeah.
Yeah.
So a big thing that I see patients struggling with, and I myself from suffering from anxiety suffer with this, is the lack of control. And so, especially when you're in that vulnerable state, when you're in the hospital, how can we work on letting go of some of that and anticipating that things may not go in the direction that we want them to go?
Yeah. I think that's very common. There's definitely parts of birth, the birth experience that you can't control. There is things you can control to enhance your experience. One of the big things is to prepare with knowledge to decrease that fear. And I often think of birth as a Venn diagram. Those three or two circles, I guess. One is the mother's part, what they can control. The other big circle is the baby. I mean, they also play such a big role and use their wisdom and ability in the best way possible. And then there's the part of the middle that neither the mom or the baby can control. When things happen with perhaps the placenta, when maybe the blood pressure is going up and the birth story just unfolds differently. So can we prepare ourselves for those things that we can control by finding kind of like loosening our grip on, I want it to go a certain way. I mean, you can hope things go a certain way, but to, at some level, be prepared to be unprepared. And in those moments, can you tap into calm by using your breath, by finding those big inhales, sending those little messages of reassurance to your baby and leaning in instead of resisting. That's the hard part. And that's the part that can take practice as well, right? Because when we start practicing that, either not just on our yoga mat, but just in life itself, like what if you're stuck in traffic and, you're late for an appointment? Like you can really keep telling yourself, oh, this should have never happened. This is so frustrating. And the city should do a way better job at constructing these overpasses or lanes or whatever the cause might be in that moment. You had no control over that. So can you tap into your inner calm by taking a few big breaths and loosening your grip on the fact that you couldn't control it? Mm-hmm. You say, this is out of my hands. And I'm just going to be here. Right. Sometimes I heard somebody say, it's really frustrating that I'm stuck in traffic. And then somebody else says, but you are the traffic. So, you know what I mean? It's like
ancient
it's a
philosophy.
different perspective. Yeah. I don't know if that's totally relating to what I was going when it comes to birth experiences, but you are in this moment. This is the reality. And can you lean into that?
Mm-hmm. And I learned this from Betty White. You can either think of the positives or you can think of the negatives. It's hard to see sometimes.
Yeah. And the practice is seeing it, right?
Mm-hmm.
It's really easily dismissed or not trying to see it, the beauty in every moment. And that's why when people say, instead of saying to somebody, I hope your birth story goes exactly like you planned, I like to say to them, I hope your birth story, I know you have what it takes to find beauty in how your unique birth story unfolds. Can you find the beauty even in those things that you maybe weren't expecting?
That's the big takeaway, isn't it?
Yeah.
Well said. As a lactation consultant or LC, what is the most common struggle you see new moms face and what is your go-to advice?
Wow. I would say at the top of the list would be that moms think that if their breastfeeding doesn't come together in the first couple of days, that it's not going to work. So I remind all the moms that it is like building a puzzle. And your breastfeeding puzzle is composed of many little pieces. Typically for a first time mom, that puzzle is not going to be complete till probably 6 weeks, till it feels kind of easy. And in those first weeks, you are both learning. You're on a steep learning curve and you're literally just trying to piece those pieces together little by little, and slowly. And some days a whole bunch of pieces fit together, and then the next week, not so much. But it is a learning curve that you're on with your baby. Even though breastfeeding is natural, it's definitely learned, and it's like a dance. You got to find your rhythm with your baby, with your newborn. So just because a baby doesn't take all their nutrition at the breast from the first day or two, you are still on that breastfeeding journey. If you are building your puzzle still, right? You've got other pieces going. You've got the skin to skin. You have a term baby who's willing. You are, learning hand expression. You're doing all the things. And ultimately, you've got lots of time to have all those pieces come together. As long as the baby is fed somehow. Of course, babies need to eat. And as long as you're telling your body that this is the plan to breastfeed, so stimulating your body to make milk if your baby is not doing that at that time.
Okay. And then if there are some women that feel guilty if they have to feed the baby formula. And so what would you say to those moms where it can be a combination of breast milk and formula, or the breastfeeding actually didn't work out for them and they're feeling guilty? How do you provide positive framework around feeding the infant?
Yeah. Oh, guilt is so hard. And mom guilt is a thing, right? As soon as we become moms, we just feel guilty so easily. We just want the best for our baby. And sometimes it's just the best decision is to supplement, and the best decision is to use formula. Right? For whatever those reasons might be. And ultimately, the mom's mental health trumps the way she feeds the baby. We can't, if it's not right, it's not working for mom, or it's too stressful. I mean, we would never say, you must continue, you must continue. The mother's mental health is so important. There are so many other adjustments in early motherhood that you don't need a whole bunch of guilt on top of it. The other thing I would say that any amount of breastfeeding is better than none, right? So maybe that mom feels like she's failed if at 1 week, she had to give the baby formula because things were not working out with the breastfeeding. And to say, wow, but it's not like you didn't breastfeed. You did. That baby received so much goodness and nutrients and all the good things in the breast milk that it did receive. Even if those are a few drops of colostrum, that is great. So we celebrate the success versus looking at how it could have been, and in her mind, how it should have been, to say, wow, look what you've accomplished. Your baby had those beautiful drops of colostrum that you hand expressed, and that containing so many benefits that we can't undo.
Thank you for saying that, because I had a difficult time breastfeeding. I was taking Motilium to try and get my milk supply up, and it never came. And the doctor, I was almost looking into her eyes, pleading for her to tell me it's okay to let it go. And the moment she said that, because my daughter was losing a lot of weight, and then we kind of switched over to the formula, and within 2 weeks she was bulked up and juicy and beautiful. But the guilt that I had, and I physically needed somebody else to tell me that it was okay, because I couldn't fail. I couldn't stop. But the moment she said, she's losing weight, you need to supplement. And I just thought, what a relief. What a relief. I didn't want to let my baby down. I didn't want to let myself down. So it just felt like I was giving everything, like you said, at the detriment of my mental health. So, yeah, I think a lot of times moms have this terrible guilt. So, thank you for saying that. Mental health trumps breast milk. That makes me feel better.
Yeah, and we're so much into our right brain. In and around in pregnancy, and then in and around birth. I think nature has intended us to be really in tune with our own intuitive knowing on how to respond to our baby's needs. So I think that's where that feeling guilty piece comes in too, when it doesn't work out, because it's, when we normally could be a little bit more logical and pragmatic, we are so much into our touchy-feely emotional side that just adds another layer of just feeling, just like more sad and guilty if it doesn't work out the way you had hoped to. So, I just want to give moms a great big hug and say, you're doing amazing.
Yeah.
Like, you are exactly what your baby needs, right? It's just, we
Take
put
the pressure off. Yeah.
yeah, and I think the other thing is we're just inundated with information from online through our social media of all the ways that things should be, right? So constantly are questioning ourselves, and we're so vulnerable in and around birth, and we're so wanting the best for our baby that we start doubting our own intuitive knowing. And we forget that we are the ones that know our baby better than anybody, right? New motherhood, it can be so challenging.
And I think just that, like, you're this beautiful person inside and out. And your words, I think, have given moms that hug that you want to send out there.
I actually physically quite often give them a hug.
Yeah.
I remember a student nurse asking me once, "Do you hug all your patients?" And I'm like, "Oops, maybe that's not appropriate." Yeah, and in my years as a lactation consultant, so I've been certified since the early 90s. It was a little bit more of a newer thing back then. Um, and I continue to do some lactation support both in the hospital and privately. It's and it really is mainly that. It is support. It is saying, you've got time to figure this out. As long as your baby is fed, as long as we help keep reminding your body it needs to make milk. And if it's not by baby, it's by a pump. You're good. We've got time and we're going to figure this out, right? Or it's the reassurance of saying, yeah, you're doing okay, right? Because there's so much, communication happening when the baby is in proximity with the mom. So something as simple as skin to skin, the way nature has intended it. Nature didn't intend for us to wrap our baby, swallow them tightly, and put them across the room or in their beautifully decorated baby room. Babies were meant to be held. So that alone is such an important aspect of the breastfeeding experience, right? Of the learning. But there's a lot of communication that happens below the conscious level, sort of behind the scenes between the baby and the mom if they're in proximity. Baby goes through a growth spurt. Your body will make more milk. You're responding to your baby and the baby is dehydrated somewhat. Your breast milk will have more water content. It's, if you're exposed, your baby's saliva exposes the mom's body to some of the components that breast milk need to have in order to build, protect the baby with their with immunity. And so there's just so many aspects that Mother Nature has arranged. And yet with breastfeeding, there's also a lot of doubt that moms will have. And I often remind them, when you were pregnant and you were growing your baby, outside from the moment of conception, which of course had some active participation, this miracle inside you literally unfolded without much sort of deliberate interference on your part. Your body did this. Your body grew this baby. So do you think your body would have sort of built in the wisdom to feed your baby, right? So in most cases, it will, just by the nature of things, it will work out. And it takes time and it takes support. And there is, tools that we can use, and formula is definitely one of them. We often will supplement at some point a little bit, especially in the beginning, can actually be one of those puzzle pieces to keep your breastfeeding journey on the right track. So to be open to that, and you're not alone. Your public health nurse has a lot of breastfeeding knowledge. There's public health breastfeeding clinics. There's private breastfeeding clinics, but those are still subsidized by Alberta Healthcare. There's private lactation consultants. But in my experience, I often tell my yoga clients too, when you have your baby, if you have a question, they say, oh, I have breastfeeding challenges. And I said, well, let's just talk on the phone for starters. And it's just for them to hear, you're doing good.
Yeah, that
You're
reassurance.
doing good.
So you have built a beautiful community of moms through your prenatal yoga classes. Can you tell us a bit about that?
I love to talk about my prenatal yoga. I really do. I feel so incredibly grateful that I had the opportunity to combine my experience as a labor delivery nurse, community health nurse, lactation consultant. I was terrified of stepping back from my role in the hospital because it truly is my passion. My classes now include an element of education. Each class starts with about 15, 20 minutes of birth education so that women walk away not just having done a yoga practice, but also have learned about some topic as it relates to pregnancy, to birth or postpartum or motherhood or breastfeeding. I stepped away from my role as a labor and delivery nurse about 4 years ago and started my own business. I'm teaching prenatal classes, prenatal yoga classes. I still am in the hospital occasionally as a lactation consultant. I stay connected with that world and stay more current on any kind of changes when it comes to policies or rules of the hospital. I'm also involved in birth education. So I teach for a company who teaches birth education classes. Love doing that as well. And then along with some workshops that I run on labor support and yoga and breastfeeding. So yeah, it is a private home studio. But I'm glad that the space is limited because I want it to feel small. I want it to feel comfortable and safe for people to share their experiences. So a few years ago, I had a lady who was pregnant with twins, and this was her second pregnancy, had a 2-year-old at home, and she came faithfully to every prenatal class weekly. But she just lied down and rested, and she just was literally soaking up the supportive energy around her. But that's what she needed. And this is your yoga. You are tuned in to what you need and, serving your body and honoring your body. And if rest is what you need and be in this space with us, then all the power to you. That's fantastic.
I have attended your class.
You did.
And
That's
it
right.
was very, very special. I remember a moment you put on A Wonderful World. And I think it was at the end of the class, we closed our eyes and put our hands on our belly.
Aw, I remember it. That was your first. So that's a while ago.
And
Thank you for sharing that.
Yeah.
Really, that warms my heart.
Yeah.
Yeah, I try to include playlists. I always read a poem at the end of the class. For those girls who come 2-3 times a week for months on end, it's challenging to switch it up each and every time so they don't hear the same thing twice. But it also keeps me busy, and I can't imagine doing anything else. I truly, truly, and I mean it from the bottom of my heart, feel so privileged to have that small part in those girls' pregnancy journey, and I feel quite maternal over them. My kids are also that same age, or actually a little bit older now. I'm expecting my third grandbaby in just a couple of weeks. Yes, last night I was a little bit distracted as she had called me just before I taught a class last night, and she lives in the Netherlands. And she said, "Oh, it's the middle of the night, and these cramps are keeping me awake, and my flight doesn't leave for another couple of weeks." So it's like, oh my goodness. Yeah, but other than that, I love prepping for the classes. I love teaching them. I love getting to know the girls, and I feel really honored that they trust me to feel a little bit more prepared for that victim.
I think that's why I got choked up, because of the power of that connection was just incredible.
Yeah. And how much inner peace we have. Sometimes it's just to know how to access it, right? Sometimes we just literally need to shut out the outside world where our attention is continuously pulled outwards and pull that energy in and notice. Just notice what's happening. Notice where your attention is drawn to. Like, what are those reoccurring thoughts? And to remember that thoughts are not us. They are separate from us. And we have a choice, right? We can redirect our attention away from those thoughts, which then creates a whole different emotional landscape. And which is then in turn going to influence how we experience what we're going through.
Beautifully said. Now, what is the name of your business and where can people find you?
My name is I Am Stam Yoga, which is my 2 initials. And then under that, the prenatal classes are usually referred to as Baby's Breath Prenatal Yoga, Baby's Breath Mom and Baby Yoga, Baby's Breath Postnatal Yoga, and then all the workshops are under there as well. It's a really hands-on workshop on positioning, on labor support techniques. It actually includes a little partner prenatal yoga practice.
If you could whisper one thing to every pregnant woman the night before her birth, what would it be?
Trust your body, trust your partner, trust your baby, and last but not least, trust the medical system. We are there for you to facilitate your birth experience in the safest way possible. Trust that you have what it takes to find beauty in your unique birth experience. Yeah, and to let go of that tight grip of trying to control those things that you can't control. So, and to use your breath to find your calm, to create space. Actually wrote a poem years and years ago, and I often share it at the end of my class. I could maybe
Please do.
It
Please
might,
do.
yeah, it might relate here in answer to your question. As you get closer to your due date and meeting your baby, may you have the strength to face that day with confidence. May you have the wisdom to trust your intuition. May you have the courage to surrender to your birth story as it unfolds. May you breathe in ease in moments of intensity, and may you always be in awe of you and the miracle of birth.
I didn't know we were going to have a laureate on here today, too. Thank you so much for coming and speaking with us today.
It's my pleasure. It was amazing to be here. And just feel so grateful and honored that you invited me as your guest.
Thank you so much. And if you enjoyed what you heard here today, you could really help us out by liking, subscribing, following us on Facebook, Instagram, YouTube, and Spotify.
If you have any questions about what you heard today, please reach out. Sarah and I would love to hear from you. Email us at birthslater@yahoo.com. That's birthslater@yahoo.com. We are here to support you every step of the way. And now for the legal language. This podcast is solely for educational and entertainment purposes. This podcast is not intended as a substitute for professional advice from qualified individuals involved in your prenatal, labor, and postnatal care. Every pregnancy and birth is different, so always talk to your healthcare provider about what's right for you.